Great, we're going to go ahead and get started. Thank you to all of you who are spending your lunch hour with us today. So just to introduce our webinar series once again, this is the CPHA Colorado Public Health Association Health Equity Webinar Series, facilitated by the Health Equity Coalition. And the topics for this webinar series were collected through group consensus, and we've been rolling out different ideas throughout the course of these past few months based on everyone's feedback at Public Health in the Rockies, trying to bring you current events, current issues in public health that are relevant and really focused on bringing equity into this field. And so we're grateful again to all of you who are joining us from different backgrounds, different experiences, and we hope to get some of that sharing today during our discussion. So I am here as a facilitator for this webinar. If you have any questions throughout the webinar, any issues with your Zoom, feel free to chat me directly. You can do that through the chat function on Zoom. I also wanted to let you know before we get started that we will be having a Q&A at the end of the webinar. If you have any questions throughout the webinar that you want to remember, you can feel free to type those directly into the chat for everyone to see. You can also raise your hand at the end of the webinar during the Q&A if you'd like to ask your question directly to the speaker. So those are your two direct ways to ask questions during the Q&A. So I'll go ahead and pass along the torch to Nami to introduce our speaker. Thank you again.
Thanks, Marissa. Hi, everybody. I'm Nami, Nami Thompson, sometimes Nami Basine. And Jason could not be here today. He's on TV, actually, talking about male mental health, and he will be joining us a little bit later. So I'm here to introduce Dee DePerson, the Executive Director of Mile High Health Alliance. She's an award-winning, forward-thinking nonprofit strategist with 20 years in senior management, building successful nonprofit organizations that affect change. Dee is passionate about nonprofit advocacy, systems transformation, building programs, sustainability, cross-sector collaboration, and intersectionality. And she holds a bachelor's degree from Cornell University and a master's degree in nonprofit management from Regis University. And Dee, we're so grateful to have you here to help us kick off this conversation about the census, something that's very critical for us to all think about and start engaging with our communities about. So I'm going to pass it on to you, and thank you so much for being here.
Great, thanks so much for having me. It's always so embarrassing when somebody reads your bio, but I appreciate the introduction, and I'm going to apologize because I think you're probably going to get more of a sideways view because I have sort of a computer and a monitor going on. Thanks for everybody who joined us today. I'm going to start by saying I'm not an expert on the census. I'm just sort of a converted zealot. I went to a big day-long workshop last October that was hosted by, well, let's see, Rose Community Foundation, Colorado Nonprofit Association, Colorado Association of Funders, the Denver Chamber, and spent a day at this workshop. And that really sort of got me going on the impact this is going to have on everything across the state, but particularly in sort of the wheelhouse of health and public health. So I've learned a lot about it. I may or may not be able to answer all your questions, but I'm looking forward to the discussion. So just a little bit about, all right, now of course my thing is working. There we go. We'll do it this way. A little bit about the Mile High Health Alliance. You may not have heard of us. We're about 3 years old. Our focus is on improving health in the city and county of Denver, and particularly around access to care. And our focuses are our constituency are Medicaid, uninsured, and underinsured, which is about half of Denver's population. We really try to work in collaboration to break down silos to solve big problems with the health system. So that's a little bit about us. So the census. One of the most important things I think about the census is that everyone should be counted. Everyone is supposed to be counted. Anybody living in the United States on Census Day, which is April 1st, 2020, should be counted. The challenge is it's not always that easy, right? There are hard to count populations. We'll say more about that. There's been some chilling effect by the current federal administration. And there's some reasons why we don't always do a good job. And there's some consequences of that. But the census determines some pretty big things, not only population for the state, and a lot hinges on that, as well as demographic information. Representation, some of you may know that our congressional delegates are allocated based on population, and Colorado may be getting an additional congressional delegate. when we see what the final numbers look like, we may have enough people that we may actually like get an initial delegate. And then obviously funding, particularly in public assistance programs and public benefit programs. There we go. A couple things about the data in the census. It is confidential and protected. There are actually constitutional amendments and titles around this that try to keep the census data as protected as possible. For example, anybody that works on a census has to swear a lifetime oath not to share information. The records are confidential for 72 years, and the penalty for wrongful disclosure is $250,000. So they've really tried to protect the information as much as possible. That said, I understand, particularly in the current environment, that the idea of handing information over to the federal government may be a barrier for some in terms of completing the census. This year is going to be the first time the census is predominantly online. It doesn't take long to do. It's available in other languages, and there are other ways to do it: phone, mail, in-person interview. But again, the sort of digital first sort of entry, again, may be a barrier for some people who may prefer to do it by phone, mail, or in person. So just a lot of that's new about this particular census that hasn't been done this way before. General timeline. So April 1st of this year sort of kicked off census year, right? It's like, here we're a year out, here it is coming, right? And so this is the general timeline and process. A lot of the focus is going to be on that April 1st, 2020 census day. But then there's reminder and follow-up, and then there's like the delivery of all this information to the president and the changes that fall out from that. So why do we care? Funding is probably the biggest reason why we care. You know, the census establishes what's going to happen, and the money's available to the state for the next 10 years, which is a huge amount of time when you think about how programs, populations, and other things grow over the course of a time. So as an example, the 2010 census brought in $13 billion in federal funding for Colorado in 2016 alone. That's about $2,300 per person per year. $5 billion of that was for Medicaid alone. And it's not only about supporting health and direct health programs like Medicaid, CHIP, Medicare Part D, but it's also the things that support healthcare, right? Like housing assistance, heating assistance, food assistance, all those things that are sort of the social determinants of health that support people in their health. So when you look at that $2,300 figure, think about every person we miss is going to cost the state $2,300. And I broke down some numbers. Every person we miss will cost us about $900 in Medicaid funding alone. So when I think about our safety net providers and the importance of Medicaid, that's the sort of like big hook right there for us. I also linked to George Washington University has broken down a lot of this in more detail. So I've linked to their sheet on Colorado. It's called Counting for Dollars. It sort of breaks this down in a little bit more detail. But I think funding is one of the main drivers, and making sure that we get the money we need to support the programs to keep folks healthy in the state of Colorado. Then we have redistricting. I mentioned that we may get an additional congressional district. What is interesting in Colorado is that we have this new independent redistricting commission that voters approved in November of 2018 that we've never used before. So it's going to be interesting to see in Colorado how this unfolds and how independent and how fair that redistricting happens. It also has implications for whatever county, whatever city you're in. I know that the city and county of Denver is likely to get divided into two. Historically, we've been one congressional district, but we're probably going to have so many people get divided in two. So there's a lot that rides on this in terms of representation and which communities are represented and whether they're fairly represented. That happens, that I think is a huge part of equity in that space. Making sure I've said anything I want to say. There are questions on race and ethnicity. These are the two questions that go both to Hispanic origin and then race that they've divided out. And I know these are sort of never perfect, but these are the ones they've come up with for this particular census, and we can talk more about how these work out. I'm not an expert on it, but I know that they've added some additional language and some additional identities rather than sort of just lumping people into one huge identity. They've gotten a little bit more granular about it, which I think is helpful. You may or may not have heard about this, but the Trump administration is trying to add a question about citizenship to the census. You know, I think overall this is just trying to get people not to answer the census. It is still in litigation. We don't know. We have to know by June because that's when they actually start printing things. We have to know by June whether it's going to be on. There's a bunch of court cases. A couple of courts have rejected it. I'm looking, New York, California, Maryland have rejected inclusion of this question. It's on the, I think it was on the April docket. The decision has to be made by June. There are more court cases coming. One of the biggest pushbacks around this is that actually census questions go through a long sort of process before they're added to the census, and this is called testing. So a lot of the pushback has been around opposing the addition of any untested question, whether it's citizenship or anything else. And actually the Colorado Association of Funders took a position back in October, the board did, supporting a full and accurate count and opposing the addition of any untested questions, which is in many ways a proxy for the citizenship question, but it sort of is, I think, a little bit easier bar for people to get over just about the opposing untested questions. So we're hoping this goes our way. We don't know. This doesn't affect the requirement for people to respond to the census, but obviously could have a chilling effect. There are a lot of challenges, right? This is some of the challenges, you know, particularly I think in a lot of areas of the state, we've seen a lot of moving around, gentrification, dislocation, mobile population. The constrained fiscal environment, I'll talk a little bit more about that, but this census has been underfunded by the federal government, which I think has been a strategy. Changing technology, the first digital census, a lot of information, distrust in government, the chilling effect. We've already seen declining response rates, I think linked to distrust in government, and that's a problem. Again, it costs us a lot of different things in terms of representation of populations and also in terms of funding. An increasingly diverse population, we've seen a change in how they're asking about both country of origin, nationality, as well as race, but it never quite matches the diversity that we have in our country. One of the things that's keeping me up nights a lot is this last bubble around informal complex living arrangements. I know in Denver and I know in a lot of parts of the state, we're seeing people living essentially off lease. They've got too many people in a dwelling unit, or they've got multiple families in a dwelling unit. In some way, they're violating their lease, and they're doing it to make it work because they're not housing it because it's too expensive. When the federal government comes knocking and says, how many people live here, I'm really worried and understanding that people might not answer that question honestly. And so what that means is undercounting, and that's a huge, huge problem. Hard to reach populations, there's a long list. Children, LGBTQ+, immigrants and refugees, we mentioned complex living arrangements, homeless. There are non-English speakers, people experiencing homelessness. We've had a lot of conversations about people who are involved with the criminal legal system and where they get counted. Do they get counted where they are now in the jail or in corrections? Or do they get counted where they, like their last address? Where should that money go and where should that counting happen? So it's a pretty complex thing to think about how we reach and accurately count all these populations. That said, we've been doing the census every 10 years since 1790. And we know how to do some of this, but it takes resources. We know how to hire people, how to go into community, how to do that outreach and reach a lot of these folks. But it takes time, it takes relationships, and it takes money. So the federal government decided to fund the 2020 census at 2010 levels, which is woefully insufficient. For example, last census, Colorado had 8 offices. This time, we're only going to have 4. None of them are on the western slope. We don't have a single census office on the western slope. So it's clear that we're going to have to take on more responsibility. And by we, I mean us, everybody on this call, but also the state and local governments to get the census done right. I'd also point out that Colorado is one of only 10 donor states. We actually pay more in federal taxes than we get back. Our money goes to other states that do a better job of counting. So it's a really important thing for us to get this right. The state has stepped up, and I will give credit to Common Cause Colorado and a bunch of other groups that introduced legislation this year to appropriate. They wanted $12 million, additional dollars, to do the census outreach and education work. And that amount was based on an analysis done by the Colorado Fiscal Institute. I mentioned that we sort of have some idea of how to reach the hard to reach populations. Checking on time. So they actually have sort of economic estimates, and there are 3 tiers within the hard to reach population. So the sort of lightest lift in hard to count or hard to reach populations costs $2 a person. The second tier, slightly harder, is $25 per person. And the really like hard to count top tier is $75 per person. So the Fiscal Institute did some analysis and said, you know, based on what the federal government is providing and the shortfall, we need another $12 million to do this right. In final, after it got through the sausage making at the state capitol, we ended up with $6 million, half that for outreach and education. The bill also creates an appointed board, which they're going through right now, those board appointments, to distribute the funds through the Department of Local Affairs. So the money will come down through DOLA. The money will be distributed to each county based on population in that county. And then that money can be used by community groups, however the county decides, to try to reach these hard to reach populations. So it's fortunate that we have stepped up. I'm hoping sort of more money comes into that pot. I've certainly thought about other groups that are really interested in chamber outcomes, like the foundations or the chambers of commerce that might want to ante up some money. $12 million is a small investment, I feel like, for the tens of billions of dollars that will come to Colorado over the next 10 years that we desperately need. So this is some of these slides we took from Department of Local Affairs and the Colorado Complete Count Committee, and we sort of merged them. This is one from them, sort of about what the census staff has been doing and what they see as the role of state and local communities. And in particular, I highlighted provide trusted voices, because that's going to be key, those relationships. And in the health sector, in public health and the health sector, are still largely, I feel like, trusted voices in community and can provide information and accurate information about the census and encourage people to complete them. So Lily Romero Griego, who used to be with Michael Bennett, is actually the partnership coordinator. Some of you may know her, but this is really her wheelhouse of establishing those local partnerships to make sure we get this done. They've also done some marketing and outreach work. This is Department of Local Affairs website. They're really focused on educate, engaging, and encouraging. Let me just say that we're not asking people to like do the census and be enumerators. What we're asking is for folks starting now, between now and April 1st of next year, to talk to people in the communities about why it's important, why they should respond, how it's safe, and those sort of pieces. It's sort of the pre-work that comes before the census. So how to support the census. This is sort of my pitch when I talk to people, is one, we're not asking you to like create new things, but to the extent that you have established communication structures and relationships in community, use those to educate and inform, right? Use the fact sheets, you know, get that information out there, do other webinars or other meetings that you have. You know, I've done a lot of work with my membership and asked them to think about how they're going to communicate to their patients and other folks in membership. Think about events where census outreach might be effective, particularly for hard to reach populations. I know here we're looking at, we have a Safe Summer Kickoff, we have National Night Out, we have a Health and Wellness Expo. We're going to have census tables at all those, right? And having materials in multiple languages to try to get people ready for the census, make sure they understand it. And then talk about the census to everyone. I know this sounds a little corny, but literally these days, I don't have a single meeting, even if it has nothing to do with the census, where I don't talk about the importance of the census. right? I just met recently with like cannabis industry, right? And I'm like, have you thought about census outreach, right? A lot of people come through your waiting rooms. They're sitting there, they got nothing to do. I just think it's important that everybody sort of step into the space and ensure that they're doing what they can. So this is completely non-scientifically based, but this is sort of how I'm talking to people about the census, right? It's important, it's easy, it's safe, and they're connecting with people care about, right? In the health sector and public health, I'm like Medicaid, Medicare, CHIP. When I'm talking to like the chamber, right, I'm thinking roads, bridges, infrastructure. You know, I might talk about agricultural subsidies, education in preschool. I mentioned that we're a donor state, so sometimes when I'm talking to more conservative folks, I was like, you know, we are paying more to the federal government than we get back. And as I said earlier, you know, I usually use California. I apologize to anybody from California, but I'm like, you know, if we don't get all our money back, we don't do the census right, we're going to lose money and it's going to go to California. Right? It's going to go somewhere else. It doesn't create smaller government, right? People are like, oh, well, we just need smaller government. They're still going to take in that money and it's going to go somewhere else. And then this huge piece of that, it determines everything for the next 10 years. So we really, really need to get it right. So this is a little bit of information. I know I'm talking about Denver, that's where I am, but Denver has already formed a Denver Complete Count Committee. We actually have a health subcommittee. And this year, Denver already allocated $400,000 to hire a census coordinator and start doing the work already. And then that additional state work that comes down to the county will layer on top of that to give us more resources to do even more outreach to the harder and difficult to reach populations, and to do general outreach, I think, as well. So that's it. I blew through it pretty quickly, which is good because I think questions and discussion are way more of interest to me. I think also, what was I going to say? I have a lot of information, but again, not an expert. So we'll also, if I can't answer a question or don't have the information, we'll figure out where to find it and how to get it for you.
Great. Thank you so much, Dee Dee, for that presentation. We really appreciate it. So I'm going to go ahead and read a few questions that came in from the chat box. And then once we're through those, people can either raise their hand or unmute themselves as we want to continue the discussion. So the first question was about responding to the census via computer. So Karen noted that this might be a problem because if the goal is to be anonymous, your computer reveals your IP address. So thinking about this being traced back to the individual, are there workarounds?
Yeah, you can do it from any computer. So you could go to a public library, for example, and fill it out. You know, it's an online census, so you could fill it out virtually from any computer. You could do it from your work computer. You could do it, you know. So I understand that there are some technology barriers. I will say that, so if you don't answer electronically, right, then you start getting postcards, then you get mailings, and eventually somebody is going to knock on your door. So if you want it to be less invasive, actually responding electronically is probably the best way to do that, or maybe mail. But they're going to keep coming, and I won't say until they get the answer, but there's going to be a lot of touches, and the last one will be knocking on your door. And if you're worried about responding, having somebody knock on your door is probably the thing you want least to happen. So figuring out one of those other ways might make more sense.
Got it. Thank you. And then someone had a question about what DOLA stands for, and if you could talk about their role in this.
Sorry. So there's two pieces. There's the State Demographer's Office, which is where a lot of the census information sits. DOLA is Department of Local Affairs, right? And so the demographer is under Department of Local Affairs. And the way the legislation to appropriate this money, this grant funding was set up, the money is going to come down through Department of Local Affairs. So, and they're a state department, that's exactly what they do. They work with local governments and the jurisdictions around the state. So it's a good place for them to sit. But that's sort of the two pieces, the demographer's office and then Department of Local Affairs is where, at least at the state level, the Colorado Complete Count Committee and all this work is sort of being driven from.
The next question was about census outreach. Is there a central clearinghouse for information that folks can tap into?
There are quite a bit of resources. In this last thing, I hyperlinked DOLA's website. and you can see it goes to like the Census 2020 page. So there are a lot of resources there. I will say one of the reasons we redid some of their slides is they tend to be text heavy and a little wonky, you know, and we wanted to create slides that were a little bit more accessible. And anyway, so there's information there. I think they have up information at least in English and Spanish. But I also think we're working on some more user-friendly English and Spanish language materials and collateral that we're going to use for outreach, because we just think they're a little bit wonky, but they do have collateral available. I think Denver may do some of their own, so your local county may be doing some of its own too.
Perfect, great. That looks like the end of the current questions in the chat box. So I'd urge anyone who would like to ask a question directly to Dee Dee, feel free to either use the raise hand function or go ahead and unmute yourself. Since we're a relatively good sized group today, I think that should be okay. If we're just
I'm going to jump in if I can. This is Karen with Right by Three. Thank you for the presentation, Dee Dee. I know that Denver County specifically is putting together a very strong effort. I know that from the Southwest Coalition, what they're working on. But Right by Three focus in and around, obviously, children, since they were #1 on the uncounted list. The interest, obviously, is everyone, but specifically around this group, using to see whether or not our platform, Right by Text, can be helpful to inform families, parents, so forth and so on about this as we, you know, let's say starting tomorrow going forward. So I love the idea that you're going to be basically synthesizing some of the information from NOLA to make it friendly. But in the area of early childhood, has anyone decided to consult with the early childhood councils to say, hey, collectively, can we have one voice and speak out in a very informative, non-political ... manner? Has anyone done anything like that that you know of?
Not to my knowledge. I know it's not the same as Colorado Children's Council, but I know that the Colorado Children's Campaign is sort of paying attention. And I could touch base with them just to see if they've come up with anything that's more sort of kid specific. But I don't know if there's been any direct communication with the Early Childhood Council.
Well, then, thank you for that. And then I'll send ECHLA some questions in and around that myself.
Right, and I think your answer is exactly what we're trying to get at here, right? Like, who's your constituency? How do you talk to them? And can you take this information and deliver it to them in a way, you know, that is helpful? Because it's different for different communities, and you talk to people differently, right, to reach them. And so I think that is perfect. That's just what I hope would come out of something like this. If people think, okay, who are my constituencies? How can I reach them? How can I help?
Unless anybody else has a question, I have 2 more from the chat, Dee Dee.
Great.
The first question is from Jennifer from the Denver Department of Public Health and Environment. She said, I work in the child care program, and will it be effective to give this census to schools, for example, child cares, licensed homes, etc.?
I'm sorry, you faded out a little bit at the end there.
Yes.
Can you just repeat? So child care, and would it be effective to what?
To give this census to schools. And then she also mentioned
the census information.
It's unclear, Jennifer. If you'd like to clarify your question, feel free. I think she said, will it be effective to give this census to schools? So perhaps speaking either to the information and or the actual survey itself.
I
think, you know, oh, sorry, go ahead.
Oh, this is me. I don't know if you could hear me or not. But I was just wondering, I kind of jumping into the PowerPoint presentation a little bit, 10 minutes probably in. And I just wanted to know, like, in our department, we really work closely with homes, licensed homes, preschools, childcare centers, after-school programs, ECEs around Denver public schools. And I heard a little bit about like the census that you guys are, and the families that you guys are trying to target, which we have 6 inspectors around. We do licensing and health inspections around all of these centers. So my question was guiding towards, will it be very effective for us to share this information with our providers, our directors, our principals, to make sure that we are targeting in that people that you were talking about that are hard to reach, so they can complete this type of surveys?
I think so. I mean, I think, you know, when I talk about, I don't know how many of you have done campaign work or sort of in, you know, sort of in the world at large, the research shows that it takes 7 touches to move somebody to action. That's why you get so much campaign literature, right? Like you get a call, you get a mailing, somebody knocks on your door, right? Then you get a text message. It takes 7 touches to move somebody to action. And so that repetitive nature is actually really helpful. Like you get it at like, I don't know, the grocery store, right? And then you get it at the safety net clinic. And then you get it at like, you know, the licensed childcare. Like you're getting it from different places. And that's what will help sort of move people to action and responding. So my sort of approach is, you know, there's no wrong door. If everybody is educated, the more information people have, the more, 1, people will understand what it's about, 2, that we can make sure we get correct information out, which I think is really important about sort of the security of people's responses and that it doesn't sort of get back to landlords, that kind of thing. So I think the answer is yes. It's a question again of figuring out what's the right frame and messaging and materials for your particular constituency.
And then I'm sorry, somebody else wants a question, but also, our department is the PHI department too, where it is public health inspections. And we do work really closely with the people that go to residential inspections.
Yep.
So I could potentially hook you up with someone that is a supervisor for that specific department. And then I think it will be very beneficial if they could help you out with this one. And also with us, my supervisor can hook you up with someone at the Early Childhood Council, because I did hear somebody talking about it. And then we can share all of that information or get together to do some of these type, because we do quarterly forums with the council. So we can totally like get together and do something like that, so we can spread the word if you would like to.
I think that would be great. You know, I'm thinking, and again, you know, I think being imaginative and being sort of strategic, right, about how can we reach people. I've, you know, talked to the people at Project Angel Heart, right? They have people that deliver food, right, like every week to people, and they have a relationship with these people. You know, can they take census data, right, or information about the census as they're delivering food, right? Like I said, I'm thinking about all these places where people go, where we can sort of make sure that they're getting the correct information. I think that really is the push. Let's make sure that we get as much information out to as many people as possible.
Perfect. Thank you.
You're welcome.
It looks like we have one more question from the chat box. Kelly is asking, Dee Dee, how are you working with groups like Together We Count?
So not yet. I think, you know, there's Together We Count, we have our state sort of city and county, group, and then we have the Colorado Complete Count. And we're trying to figure out how that all comes together. We're like a tiny, like we have like 6 staff, right? And we're just sort of, we're involved in this, but we're not super high level. It's just something that I'm pretty passionate about, I've been talking a lot about. So we're trying to figure out what our bandwidth and what our capacity is to be engaged, and what our role is as a health alliance to help spread the word. So the answer is not yet.
Great, thank you. It looks like that's the end of the questions from the chat box. So I'd like to just open it up again to anyone who'd like to ask a question.
Hi, this is Susan Moyer. Can you hear me okay?
Yes, we can.
Yes.
Well, I just have a suggestion for Dee Dee.
Yeah.
That for public health in the Rockies, the abstract for the Ignite presentations is due, I believe, the end of next week. And I'm thinking that this would make a fabulous Ignite presentation.
Okay. I hadn't really thought about that. And I think, you know, with this group and in general, we could dig much deeper. You know, I'm like a white woman, right? But we could dig much deeper in sort of the health and equity implications of this higher level presentation that I've done. And that might be really interesting, but I'm not sure I'm quite the person to do that, or I wouldn't want to do that on my own. But really thinking about how all this plays out. And I think some of it is maybe is maybe obvious, but I still think it needs to be called out why it's particularly important to the communities that most often don't get counted well, and what the implications are for health and equity around them.
Yeah, and the Ignite presentations are only 5 minutes long. They're very fast. And I think what I was thinking was the message really being how important it is for all of us that are interested in public health matters to be your messengers or be messengers of the census, I should say. And if that is all that comes out in the 5-minute presentation is why it's in the key things you outlined, what makes it important to do, and that it's our jobs to get that message out.
All right. Well, I will think about that.
More work for you.
I know. I was just like, Susan, you're giving me more work, really?
Yeah.
It's like every meeting I go to, I walk away with more work. I didn't think that was going to happen here. Any other questions?
It looks like we have some additional comments in the chat box right now. Chelsea is saying, I think that's a great idea. So another vote for your Ignite presentation. And then Amy has added that there's some good messaging information from a website acronym NALEO, Census 2020, and she's linked that in the chat box as well for anyone who's interested.
Yeah, and NALEO is the National Association of Latino something organizations. I missed the E. Anyway, yeah, and I think that different, particularly national groups, are really working on messaging to reach their communities. And more is going to be coming out. What I'm really hoping is that some of this state census grant money will roll down to community organizations who really are on the ground, who know who the community leaders are, and know really sort of how to reach people in different communities, in their local communities, and the best ways to do that.
Great. Well, I'll give everybody one last opportunity. If there are more questions, please go ahead and make your voice heard.
This is Karen again chiming in. I stepped on somebody, so I'll step back and let them speak first.
All right, thanks, Karen. This is Ashley Wheeler-Bell. I just wanted to follow up on that kind of Ignite idea with the understanding that maybe the ask isn't that Dee Dee just do the work herself, but being a member of the CPHA Health Equity Coalition and hearing the importance of this messaging, and also knowing that a lot of our members will be present at Public Health in the Rockies, that potentially a takeaway item could be to collaborate with Dee Dee in coming up with a plan for ensuring that this item is addressed, or even in one of those Ignite presentations, and ensuring that one of our representatives could even like be the messenger per Dee Dee, so that she is not taking on extra work to spread the message, but empowering others to engage.
I think that's a great idea. You know, and I'm certainly happy to help out too, like to collaborate or like, anyway, so if folks are interested, you have my contact information, maybe we can follow up afterwards.
Absolutely, and I'll engage with Marissa and you and Jason Vitello as well, and make sure that we're kind of making sure that that doesn't get dropped.
Great, thank you. And thanks for the suggestion too. I mean, I think it might not be me, but I think it's a great audience and a great place to do it.
This is Stephanie Salazar Rodriguez, and I work at the Mile High Health Alliance. I'm also on the Health Equity Committee, and I certainly would be interested in playing a role in that as well.
Thank you, Stephanie.
Stephanie and I work together. Any other questions? Well, thanks so much for the time. Thanks for listening. Thanks to all 44 of you for being on, taking time out during your lunch break today to hear about the census, which maybe doesn't sound like the most exciting thing, but I'm actually kind of excited about it. And I hope you are a little bit more excited about it too.
Thank you so much for your time, Dee Dee. As a reminder, Dee Dee's email is on this slide. If anybody is not a CPHA member and would like a copy of the slide set or of the recording, I'll copy my email down once more at the very bottom of the chat box. You can go ahead and send me a direct message and I'll go ahead and send those over to you. One more plug for the CPHA webinar series and the need for us to really bring together diverse voices and diverse relevant topics for this community. So if you have ideas of speakers, if you have ideas for really relevant topics that our group needs to be discussing and be aware of, please feel free to reach out to me as well with any of those ideas. We're always looking for more speakers, for more voices to really spread their message and what needs to be discussed in this community. So thank you all for your time today, and we look forward to talking to you all soon.
Thank you.
Thanks, everybody.